Corla. Minister, we have an enormous health crisis in this country with over 1 million people on waiting lists for medical procedures. This, coupled with housing, has to be our biggest challenge in this country. But like housing, this and previous governments have failed miserably to challenge the crisis with any meaningful success. In 2016, I was first elected to the Dáil, and soon it became apparent that we had a health crisis that no one was tackling. People going blind in the want of a cataract operation, people in dire pain, in the need of a hip or knee operation, people of all ages suffering on waiting lists and going nowhere. Minister for Health Stephen Donnelly launched a £350 million waiting list action plan in February of last year, which committed to reducing active waiting lists by 18%. But fast forward to the end of the year, those on waiting lists only dropped by a modest 1.6%, fewer than 11,500, instead of the planned 132,000 people. At that time, a staggering 887,500 were on waiting lists. 97,000 of these are children. When the additional 243,000 waiting for CTs or MRIs or ultrasounds nationally are added, it takes us way over 1 million people on waiting lists. This weekend, 3 buses will leave Cork and Kerry, taking people on waiting lists, some close to 5 years, waiting for operations in Belfast under the cross-border scheme. Many of these are up at 3 a.m. in the morning, coming from places like the Mizzen and Beara Peninsula. Some of these are people over 80 years of age that have worked honestly, Minister, and worked hard in this country, paid their taxes, and at a time when they want a small procedure like a cataract, they are left go blind. 2 of these buses go up for cataract procedures to Kingsbridge private hospital, and I would like to thank the private hospital for working with myself and others in saving thousands of people's eyesight with cataract operation. But it's not just cataracts. As for the first time, we are running a full bus from Cork and Kerry to Kingsbridge, people of all ages who need hip, knee, carpal tunnel, prostate surgeries and other surgical procedures, all left in pain or the worry that their disease will spread. This same-day up and down bus, organised by myself and Deputy Danny Healy, is the first of its type in this country, where these long-suffering patients will have their consultations and pre-ops on Saturday and home that night. Each patient travelling knowing they will now have surgery in 2 to 3 months, light at the end of a very dark tunnel for them. I asked my staff to randomly pull out a file from one of the patients going up for hip consultation to Belfast on Saturday morning, and they told me that this man in West Cork has been waiting 2.5 years in Cork on one waiting list or another, and the pain's gone too far. So he's going the only solution possible, and this is a reimbursable operation in Belfast. Minister, you were Minister for Health for many years, and in this time, health issues got worse, not better. I have people who are double amputees in West Cork and can't leave hospital as they have no home help. No endoscopy unit in Bantry, you were down there yourself, you made the announcement, but it never happened. No stroke unit for Bantry Hospital, announcement after announcement, it didn't happen. The list of shocking failures by the HSE are continuously happening, leading Paul Cullen, the Irish Times, stating that management in the HSE are stubbornly resistant to change. Do you agree with Paul Cullen's statement, and will you be honest and admit that HSE are a complete failure, leaving exhausted HSE staff and patients in pain?
Minister Harris?
No, I absolutely will not, because, well, you can have a go and slur the government if you want. The many people, when you talk about the HSE, that's hundreds of thousands of people working every day. It's nurses, it's doctors, it's healthcare assistants, it's people who get up and work bloody hard to try and actually run our health service. So no, I won't agree with kind of cheap shot political lines at all. But I will agree that we continue to face major challenges in terms of healthcare, and we're all aware of that, and that the Minister for Health, Minister Donnelly, is presiding over what is the largest expansion in the Irish Health Service. And again, there's very clear stats to show this. If you look, for example, at GP access to diagnostics, 500,000 people in 2022. If you look at 20,000 more people working in the Irish Health Service, the people you want to criticise, 6,200 more nurses, 2,000 more doctors and dentists, 3,000 more health and social care professionals. We're working now on making sure we can train more people, wanting to very significantly expand the number of doctors we train, nurses we train, speech and language therapists, so we can really beef up our health service. We've seen the largest expansion of beds right across the health service, and putting in place the primary care teams. So do we have challenges? Yes, we do. But are health outcomes improving? Yes, they are. Are we seeing a very significant reduction in waiting times when you compare it with the COVID peak? We are. Every health service across the world and every country that went through lockdowns and restrictions as a result of COVID saw a very significant increase in their waiting lists. Up until COVID, actually, we'd been seeing modest improvements in waiting times, particularly for inpatient and day case. The COVID pandemic really saw our waiting list go through a very, very difficult period. And there are now 135,000 less people waiting at the end of last month, waiting longer than the Sláintecare targets of 10 to 12 weeks than they were at the COVID peak. So I absolutely accept there are challenges. I absolutely accept there are more to do. But I believe we are on the right path in having that agreed plan that is Sláintecare, having an understanding what wait times look like, having a level of investment in terms of beds and staff that is unprecedented. But now comes the tricky bit, and now comes a bit about reform. The new consultant contract that Minister Donnelly has put in place, making sure that we staff our hospitals in a way that works, particularly at discharges at weekends, and absolutely an issue that I acknowledge you're passionate about, how we use our level 2 and our community hospitals as well to better effect.
Minister, and you said that I'm having a cheap shot. I'm having a cheap shot at nobody. I'm standing for the people who are suffering in this country. I'm standing for the staff that have been neglected by at the very top and have been overstretched in their hospitals. So how can you stand here and praise a system that leaves a double amputee in a hospital that can't go home because they can't find home help? How can you stand over the HSE who announce year in, year out they'll have an endoscopy unit and a stroke unit in Bantry Hospital, but no delivery? How can you stand over people travelling by cars, passing Bantry General Hospital every night after 8 o'clock because the accident emergency is closer and having to travel 120, 130 miles to CUH, to a bottleneck in CUH, I may add? How can you stand over a mental health service that's losing beds in West Cork? How can you stand over people over 80 years of age travelling to Northern Ireland, getting up at 3 o'clock, not coming back for 36 hours later to have a 25-minute procedure, and you stand up here and saying, I'm having a cheap shot, you're having a cheap shot at every man, woman and young person that will travel in that bus, 70-something of them next weekend, that are suffering in pain, that needs the hip, that need the prostate operation, that need the cardiac operation, and you have failed miserably to deliver it for them.
Thank you, Deputy Collins. Thank you.
Well, thanks, Deputy Collins. We're also, though, living in a country that has the highest life expectancy in Europe, as deemed by the World Health Organization. So not everything that you say about that organisation is entirely true either. They must be doing something right. We're living in a country... No. If you want to blame the HSE for everything that goes wrong, you then also have to acknowledge when the health service does see progress. And it is a statement of fact that you're living in a country, as are your constituents, that has the highest life expectancy in Europe. You want to blame the government for everything, but when something kind of good happens, that's incidental, that's nothing to do with us. Can't have it both ways. The reality of the situation is, and I acknowledged it very clearly at the start, there are too many people waiting. There are too many people waiting too long. But it is also true to say, that there are fewer people waiting now, last month, than were at the COVID peak. And we are seeing real progress and real inroads as a result of an unparalleled and unprecedented level of investment. And that will continue, and it will benefit your constituents. And the new ophthalmology service that we're going to see in Cork this year will also fundamentally benefit them too.
Thank you very much.